Right, welcome to today's video. Today we are going to talk about anti-ulcer medication, and then our outline of this particular video will be simple. We'll talk about the definition of what we call PUD, which is peptic ulcer disease, the types, what actually causes the disease, and then how it comes about. That's the pathophysiology. Then we go to our main topic, which is the ulcer drugs, the anti-ulcer medication. We talk about the classes. All right, let's go. So, definition is very simple. PUD is just a breach in the epithelium of a mucosa. If that breach occurs in the stomach, that's the gastric ulcer. If it occurs in the duodenum, then we have duodenal ulcer. So basically, we've talked about the definition. The types, there are two: gastric ulcer and duodenal ulcer. Now to the causes. What actually causes peptic ulcer disease? There are three main causes, and one of the commonest cause is H-pylori infection, or H-pylori, Helicobacter pylori. Two is the use of NSAID. These are certain types of painkillers, and then consistent use of it can also lead to the breach in the epithelium. And the third one is stress-related mucosa damage. We will talk about that one later, but it's basically, in this kind of ulcer, there is no H. pylori, there is no NSAID use, but it's either the patient is critically ill or stressed. Stress can lead to production of cortisol, a hormone that can actually lead to production of, or reduce the production of, certain useful prostaglandins which protect the mucosa wall. Also, stress can also lead to the production of catecholamines. And these catecholamines, they cause vasoconstriction. Basically, they prevent blood, or they reduce blood flow to the stomach or to the duodenum, and thereby reducing the extent of mucosal formation. So we will talk about the stress-related mucosal damage. So basically, we have three main causes: H. pylori, NSAID, and then stress-related cause. But the commonest one is H. pylori, and then the NSAID. So those are the two that we'll focus more on. Now, to the pathophysiology, that's where most of the talking will be. And then understanding how the ulcer comes about will help us to know the classes, where each of the drugs function, at what level do they act to treat the disease. Okay, so the pathophysiology. With the pathophysiology, we have to understand some basic things. There are factors that actually protect the stomach wall from ulcer, or from getting ulcerated. And there are other factors too that actually worsen the case, or they causes ulcer. So with the protective factors, we have what we call bicarbonate. From our basic science, bicarbonate is what? Is a basic, or is a base or alkaline solution. In other sense, we'll be able to neutralize the acid in simple terms. So it's actually a protective factor. We also have what we call the prostaglandin. I earlier mentioned about this. So the body in its own sense produces prostaglandins, and this prostaglandin, their function is to make up the mucosa. They make up the mucosa and then protect the stomach or the duodenum from being ulcerated. They protect it from these factors. And then mucus is what actually forms the mucosa. So these are the three main protective factors. And then to the aggressive factors, we've already talked about H. pylori. It's a bacteria or an organism that can cause inflammation in the mucosa or in the epithelium, and that can lead towards the breach or to the ulcer. We also have acid itself. Production of acid is good thing. The body uses the acid to digest some of the food that we take in. But if the production is abnormal or if it's not being checked, that can also lead to ulcer. NSAID, as we've already said, continuous use of it can also lead to ulcer and stress. So ulcer actually comes about. The pathophysiology is simple. Whenever there is an imbalance between the protective factors and the aggressive factors. So anytime that the aggressive factors are actually higher as compared to the protective factors. So for example, when someone takes in NSAID continuously, that's an aggressive factor. Taking certain types of NSAID like diclofenac, based on how they work, we'll talk about it and you guys will understand. They actually reduce the production of a certain type of prostaglandin. And the prostaglandin, as we said, is a protective factor. So in that sense, there is an imbalance, and that can lead to what we call ulcer. If there is H. pylori infection, for example, the H. pylori, they eat the epithelial layer of the duodenum, and then that can expose the layers below, and that can also lead towards ulcer. So basically, the pathophysiology is as simple as that. When there is an imbalance between the protective factors, these ones, as against the aggressive factors. To understand the pathophysiology better and the classes of drugs, we have to actually get to know how acid is produced by the body or by the stomach. So we have the cells in the stomach. These cells are called parietal cells. Those are the cells within the stomach that produces acid. And we have to get to know how these cells produce the acid. So it's just simple. First, there's a stimuli. Something will trigger it. For example, food. The smell of food or the thought of it can lead to the production of acid. So let's see. When there's a stimuli, there is a cell called the gene cells in the stomach, the gastric cells. They are stimulated when you think about eating or when you smell it. They are stimulated. And then these cells, when they are stimulated, they release what we call gastrin. They release a hormone, and the name of the hormone is called gastrin. So gene cells, they produce gastrin. It's very simple. And when the hormones are produced, they bind to their receptors in the stomach, and that leads to the release of histamine. When the histamine are released, histamine also goes on to bind to their own receptor, and the name of the receptor is histamine 2 receptor, or H2 receptor. And when they bind to the H2 receptor, they also go on to stimulate the last pathway of acid production, which is an enzyme called H plus stroke potassium ATPase. That's what we normally know as the what? Proton pump. So let me take it again. You thinking about food. The food will stimulate the gene cells, and then the gene cells will produce a hormone. The hormone is called what? Gastrin. This gastrin, they will bind to their receptors, and binding into their receptors will lead to the production of histamine. And the histamine too will go on to bind to their receptor, and the receptor that they bind is H2 what? Receptors. When they bind to the H2 receptors, what they do is to stimulate this proton pump to produce what? Acid. So that's basically how the acid production comes about. And then we have another way that it can happen. When there's a stimuli, like when you smell of food, or you think of food, there is a nerve called vagal nerve. They are also stimulated, and they produce what we call acetylcholine. This also binds to their receptor, M3 receptor, known as the muscarinic type 3 receptor. So M3 receptor, and what they basically do is the same thing. They also stimulate the proton pump to produce H plus. So basically, the main enzyme that leads to the production of H plus is this, the proton pump. So the most effective drug that will lead to the reduction of H plus is basically a drug that will be able to block or prevent this enzyme from what? Working. And you know of that drug. Those are the drugs that we call the proton pump inhibitors, the PPIs, proton pump inhibitors. And we will talk about them, but you can mention some: omeprazole, esomeprazole, rabeprazole. There are a lot. So one of the class of anti-ulcer, we are moving to the class of the anti-ulcer drugs that we can talk about, is the proton pump inhibitors. And what they basically do is to block this enzyme, the hydrogen potassium ATPase, or simply the proton pump. That's why they are called proton pump inhibitors. When they block this, because this is the final pathway for acid production, when they block this, meaning no acid will be produced. And for that matter, the aggressive factor, which is gastric acid, wouldn't be there. And therefore, you can actually prevent or treat what? Ulcer. So that's one of the class. Let's come back a bit in the pathway. You see, from the stimuli to the gene cells being stimulated to produce gastrin. This gastrin, what does it do? I'm saying they bind to their receptors and they produce what? Histamine. Histamine too binds to their receptor to stimulate the proton pump. So there are other classes of drugs too that can block histamine from binding to their receptor, so that when histamine cannot bind to their receptor, this can also not continue. You get it? The pathway is histamine will bind to the receptor to stimulate this. So we are blocking histamine from binding to this one so that this will not happen. And then we have a class of drugs called the H2 receptor blockers or H2 receptor antagonists. So H2 receptor antagonist. And examples are the cimetidine. They normally end with din. The ranitidine, and then famotidine. Do you get it? But the most effective ones will be the PPI, because when you consider the pathway, that's the main enzyme producing acid. You get it? Exactly. Yes, another class 2. So right now we know about 2, the PPIs and then the H2 receptor antagonists. There are lots of examples. You can find more, or we can talk about more. The other class that we can talk about is also in the pathway. So let's get over the pathway. Stimuli. They stimulate the gene cells to produce gastrin. Gastrin will bind to their receptor and then lead to the production of histamine. Histamine will come and bind to its receptor, the H2 receptor, and then will stimulate this enzyme, the proton pump, and then acid will be produced. So we have our basic medication that we normally know of, antacid. What the antacid will do is antacid. They neutralize the acid that are being produced. They neutralize it because they are base. They normally end in OH minus hydroxide. So when they bind to the H plus, they form water and then they neutralize it. So the third class that we can talk about is basically antacid. And the example, we have the magnesium hydroxide, aluminum hydroxide. All of these, they are found in medication products like Nugel and all other antacid. So right now we can talk about 3 classes. So we've arrived at 3 classes, but there are more of the classes of anti-ulcer medication. But before we get to know the other classes, it is very important to understand this pathway. So this pathway is simply trying to explain to us, 1, how NSAID they work, or how they cause ulcer. 2, prostaglandins protecting mucosa, or prostaglandins that protects the stomach mucosa. So let's start. There is this enzyme known as phospholipase A2. They break down phospholipids from cell membranes to this product, arachidonic acid. And there are 2 main enzymes. They are the same enzyme but isomers. We have COS1 and COS2. COS here means that cyclooxygenase. So cyclooxygenase enzyme 1 and cyclooxygenase enzyme 2. So with cyclooxygenase enzyme 1, let's focus on the 1. What they do is, when this arachidonic acid is produced, they convert the arachidonic acid to a certain type of prostaglandin, and this prostaglandin is very useful. The body uses this prostaglandin to protect the stomach wall, so it's a useful thing. This particular pathway, the COS1 prostaglandin, is very useful. It's very important. The body uses it to protect the stomach wall. And then there is the other side, which is COS2. COS2 produces prostaglandin, but this type of prostaglandin actually is the neurotransmitter for pain. When you get an injury it is that particular prostaglandin that makes you feel pain, or that actually cause inflammation of that side. You get it? So we have two things: cause one, producing a prostaglandin that the body uses to protect the stomach wall, and we have cause two, a prostaglandin that makes you and I, when we get injury, you and I, we can feel the pain. So basically, this is how NSAID, they work to treat pain and also causes prostaglandin. Let me take you through. NSAID, example, which is diclofenac. So non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. What they do is, with NSAID, what this types of NSAID, that's example diclofenac, what they do is they block both enzymes. They will block this enzyme as well as this enzyme. So they are blocking all the two enzymes. So they will block this, they will block this. So when this happens, their function, which is to reduce pain and inflammation, will take this pathway. Because earlier I said that this enzyme will what? Leads to production of prostaglandin that will make you feel pain. So if I'm blocking this enzyme, this prostaglandin will not be produced, and for that matter, I will not be able to feel the what? The pain or the inflammation. But at the same time, this NSAID also block COS1. And the COS1 produces the useful prostaglandins. And it is this useful prostaglandins that protects the stomach wall. So using certain types of NSAID like diclofenac, you will reduce the production of the prostaglandin, and then therefore your stomach mucosa wouldn't be protected. Do you get it? So your diclofenac will treat the pain by blocking this enzyme, but at the same time will also increase your risk of getting ulcer, because it is blocking this enzyme, which is also preventing the production of a useful prostaglandin, I2. Do you get it? Very good. And then that will take us to the next class of anti-ulcer drug, and there's basically one type here, which is misoprostol. I know what you are thinking, but misoprostol actually has a use in ulcer, especially NSAID-induced ulcer, which is as a result of NSAID. So misoprostol is a synthetic form of prostaglandin. Synthetic means that we humans have actually made it. We have made it in such a way to be like the useful prostaglandin that the body produces to protect the mucosa. But misoprostol is actually prostaglandin E1. It's a synthetic form of the prostaglandin. It works just like the useful one. Do you get it? So when you take in misoprostol, it will protect your mucosa, so that anytime that you take NSAID, this pathway wouldn't be a problem, because you're already taking in the useful prostaglandins that the NSAID is preventing its production. Do you get it? That's why there are certain drugs like Artrotec. You see that Artrotec has diclofenac and NSAID. So some patients will actually be on NSAID for a longer period of time, and that increases their rates of ulcer. So misoprostol is added to the medication to prevent NSAID-induced ulcer. And the pathway is just simple. The misoprostol itself is the prostaglandin, a useful prostaglandin that protects or forms part of the stomach mucosa. So the fourth class is misoprostol. or you can prostaglandin analog. Prostaglandin analog. Yes. Then we go on to the other classes of anti-ulcer medication. And then to the last but not the least class. So this class, what they basically do, they have other roles, but what they basically do is when there is an ulcer, when you're taking these drugs, they form a protective layer over the ulcer. So whether in the stomach or in the duodenum, it's like they cover the ulcer. They form a protective layer over the ulcer so that further production of acid and the stomach juices will not damage the ulcer further, so that the ulcer will get a very good environment and time towards heal. And this class, we call them the mucosal protectives. So they protect the mucosa by covering the ulcer. And you know them. One example is the sucralfate. This is seen in a medication that we call sucralfate O-gel. We also have the bismuth subsalicylate. They also form a protective layer, but they are also able to kill H-pylori. And this medication, this bismuth subsalicylate, is normally found in pepto-bismol. So basically, they protect the ulcer layer for further protect it from further damage, so that the ulcer will be able to heal well. Aside them being a protectives or mucosal protectives, they also, for example, the sucralfate also stimulates production of bicarbonates. That's one of the protective factors that we talk about. Production of prostaglandins. That's also the useful prostaglandin. That's also one of the protective factors that we talked about. So basically, these are the main classes of anti-ulcer medications that we can talk about. But we can also add certain medication. They are not, should I say, anti-ulcer per se, but they are also used to treat certain types of ulcer, which is the H. pylori induced ulcer. Since H. pylori is an organism, definitely you make use of antibiotics. So antibiotics in itself is not an anti-ulcer medication, but because some of them are able to kill the H. pylori organism, which can cause ulcer, we can also add it to our class. So our last class of drugs, we'll say the H. pylori antibiotics, and you can mention them. We have our usual amoxicillin. You can talk about metronidazole. We use them in eradication of H. pylori. Levofloxacin. We also make use of tetracycline, etc. So in brief, we talk about ulcer, which we said is simply a breach in the mucosa. When it happens in the stomach, we term it as gastric ulcer. When the ulcer happens to be in the duodenum, it's simply duodenal ulcer. The most commonest ulcer is the duodenal ulcer, and the causes three. We have the NSAID induced ulcer, and this pathway talks about how the NSAID causes ulcer. We also have the stress-related ulcer and then the H-pylori related ulcer. We've gone through the classes of anti-ulcer medication, and we've actually tried to explain how each of them work to prevent acid production. We have the proton pump inhibitor. They actually inhibit the proton pump. H2 receptor antagonists, they block histamine from binding to their receptor, which is H2 receptors. Antacid, they basically neutralize the acid to form water. Misoprostol is a prostaglandin analog, help to protect the mucosa, and then the mucosa protective as well as the antibiotics. So this video, we will just end on the class. Our next session, we will consider each of the drugs. We'll take them one by one, and then we talk more about the drugs. Thank you. This is my new channel. Please subscribe, like, and share. Bye bye.